Assalamualaikum and good day everyone. We are from Group 1B and this is our home medication review clerkship case.
For our case, patient is a 51 years old Malay lady. She is a widower and housewife. Previously, she worked as a cleaner but now rests at home due to fall. Her highest education level was secondary school and her monthly income was 1,000 ringgit Malaysia. She has been diagnosed with diabetes type 2 since 11 years ago and suffered with pain and swollen feet due to fall about 1 month ago. Her BMI was 24.2 kg per meter square, which is indicating overweight. During our first visit, we found that patient has high blood pressure, where her blood pressure reading was 137/90 mm mercury. She also has uncontrolled blood glucose level, where her random blood glucose level reading was 23.7 millimole per liter. Patient was prescribed with metformin 500 mg, glibenclamide 5 mg, tramadol 50 mg, and Prolis 300 mg. She was reviewed and we found that patient has knowledge on dose, frequency, and indication, but not the name of medication. The total score was 40, which is indicate adequate knowledge. Patient also taking celecoxib for relieve her pains. She got this from her relative. After review fetching, we found that adherence score was 1, which indicate low adherence of medication.
Some drug-related problems was identified during this HMR session. First would be the uncontrolled blood glucose level, whereby the patient's random blood glucose level was about 18 mole per liter, which was extremely high. Second issue was non-adherence to the medication. Even though the patient claims herself at the beginning where she takes the medication every day, but yet we found out that there was about 100 tablets was left, and after that the patient do admit that the patient do forget to take the medication or often skip to take the medication due to its side effect. The third issue here was drug safety problem, where the patient mix all the medication in one container and she often get confused and neglect the importance of taking the medication. And also the patient has high risk of having medication redundancy due to the medication that she has been taken for her pain relief purpose. The issue we got to figure out is the patient has very poor knowledge on her disease and medication regarding about the diabetes mellitus. The patient also does not go for follow-up because she felt that to be troublesome, and she often refilled all the medication in a nearby community pharmacy. And the final issue here was the uncontrolled dietary habits, whereby the patient does not restrict any sugar intake or fat intake on a daily basis.
As for intervention, first, we propose educational intervention to improve patients' understanding about her current chronic condition, on medication adherence, medication knowledge, missed follow-up, and also uncontrolled dietary habit. We use visual aids such as flip chart during counseling and provide informative materials to the patient, and we will reassess patient understanding about the addressed issue. Secondly, we will introduce medication organizer tool as patient has problem with improper medication storage. We will introduce pill box which will be split into sections for different type of medication to avoid confusion. And each section will be labeled using stickers with the name, indication, dose, and when to take the medication. Third, we will educate patient on lifestyle and dietary modification. We will educate patient to do mild to moderate exercise, such as walking for 30 minutes for 5 days in a week, and to take less sugar in daily diet. We will explain how these lifestyle interventions may help in controlling patients' glucose level.
Educational intervention was chosen as our main intervention, and the visual material used is a flip chart. It is a series of posters put together in a sequence to tell a story or provide step-by-step instructions. During the visit, our HMR team will use this flip chart while addressing pharmaceutical care issue or drug-related problem to convey a two-way communication manner between the HMR team and also the patient. The general goal is to ensure an effective communication is going on during the HMR and patient is able to understand better. The first objective of this intervention is to empower patient knowledge and understanding regarding her disease conditions and complications. The next objective is to promote proper and correct use of medication to help patient in self-administration of medicine, and this will indirectly help to increase patients' adherence to medications.
So this is the flip chart that we have designed for this patient. It consists of 3 pages. The first page covers the background of the disease, which include what is diabetes, the different type of diabetes, what are the symptoms the patient may get, as well as the complications if left untreated. The second page covers the treatment and the important things that need to be monitored for diabetic patient. And lastly, the last page highlights the non-pharmacological management for diabetic patient. We also provide the English version of the flipbook for this patient. Some considerations we have thought of in designing this flip chart. First, we use Bahasa Malaysia as it is easier to understand as patient is Malay. We use layman term, for example, we use paras gula dalam darah instead of paras glukosa darah. Colorful illustration is also provided to make it more interesting and also to aid patient understanding.
Moving on to the monitoring plan based on the efficacy and safety of the treatment regimen. So the first parameter based on the efficacy is vital sign, where the vital sign are the measurement of the body's most basic function to assess or monitor the medical problem. Therefore, we must monitor the body temperature, pulse rate, respiration rate, and blood pressure of the patient. Next is to monitor the blood glucose level. The self-monitoring blood glucose level is a method of choice in assessing the glycemic control and preventing the hypoglycemia. It was recommended to the patient to obtain her own glucometer or to visit a nearby pharmacy for the SBG screening. Patient also should be taught how to use the SBG data to adjust her food intake, exercise, or pharmacologic therapy to achieve the therapeutic goals. It also is advisable for the patient to record the information in a diary. Moving on to the safety parameter of the treatment regimen. The first parameter is to monitor the chronic complication due to the diabetes mellitus such as eye vision, the kidney status of the patient, symptom of diabetic foot such as numbness or tingling sensation, and also symptom of cerebral vascular disease. Then we also need to monitor the kidney profile such as pus and creatinine level periodically, since metformin may cause lactic acidosis in renal impairment patient or elderly patient. Next parameter is to monitor the symptom due to the side effect of the anti-diabetic medication. For example, metformin may cause side effects such as diarrhea, nausea, and vomiting, whereas glibenclamide may result in weight gain in patients and also causing gastrointestinal side effects such as heartburn and nausea. Lastly, we need to monitor the weight of the patient. Based on the guideline, weight loss in between 5 to 10% will help to improve the glycemic control, blood pressure, lipid profile, and the quality of life. Therefore, we must encourage the patient to achieve the normal BMI range.